Hi! We will be talking about the latest topic that affects everyone and everything in the world today, COVID-19 pandemic. And here are the things that you need to know. Currently, the most deadliest disease today that no one really expects: quarantines, city lockdowns, and social distancing. Every step that will prevent person-to-person contact has been implemented by government on almost all over the world. Most of all, people buying all essentials such as alcohol, face masks, germicidal soap, and all necessities that will protect them and their family from the virus. But first, what is coronavirus? It is a family of viruses that range from the common cold to severe acute respiratory syndrome. Coronavirus are circulating in animals and is capable of transmitting between animals and humans. It is believed that coronavirus originated on a wet market in Wuhan, China, where dead and living animals were sold, including birds and fishes. It is said that bats were not sold there but still transmitted the disease to chickens and other animals. The transmission of disease from animals to humans is called spillover event. The outbreak. It started primarily as an unknown virus behind a number of pneumonia cases in Wuhan, China, on December 31, 2019. The virus spread rapidly among countries of China and other Asian countries, including the Philippines, Italy, and some other European countries, and USA with over 300,000 cases, bringing a total of over million cases around the world today. They became epicenters of disease in a short period of time. Again, from China to at least 180 countries of 6 continents, making the pathogen pandemic. Pandemic means the disease is affecting a wide area, affecting an exceptionally high proportion of population. Philippine situation is now under quarantines and lockdowns, enforced on majority of provinces and cities in Luzon, along with the temporary closure of non-essential shops and businesses. The purpose is to prevent further transmission of the disease. Here's a little statistics on COVID-19 cases in the Philippines. January 30, 2020, the first case was a 38-year-old female Chinese national. March 28, 2020, with 1,075 COVID-19 positive patients. April 3, 2020, with 3,018 COVID-19 positive cases. But how exactly does a person acquire COVID-19? Well, there are 2 ways how a person can acquire the virus. First is through direct transmission and indirect transmission. Direct transmission is when an infected person sneezes or coughs, she passes the virus through droplets that is now inhaled by the people around him or her. While indirect transmission is when the droplets is in contact with the environment or the things we usually touch, and a person touches it, then touches his face. He now acquired the virus indirectly. What really happens when a person acquires COVID-19? It will take about 2 to 14 days for someone to show symptoms such as common colds, sore throat, fever, and all the way through pneumonia. The World Health Organization stated that people of all ages can be infected by COVID-19, but most especially older people and those with pre-existing medical conditions. For example, those who have asthma, diabetes, and heart disease. It is because they have weaker immunity against the virus. People who have stronger immunity recovers easily. Others die and were sent straight to cremation without burial ceremonies and a chance to be visited by their family. This serves as a warning for all, so let's take care of ourselves, families, and the frontliners. Today's phenomenon, it's really sanitation that matters today. So, here are easy steps to prevent acquiring coronavirus. First, wash your hands. Wash your hands, of course, with soap and water for about 20 seconds. It may seem so simple, yet can save many lives because the virus stays several hours in the human skin. Second, do not touch your face because the virus may enter on your eyes, nose, and mouth that will go directly inside the respiratory tract that will cause early symptoms such as coughs and colds. Third reminder is to cook your dishes well. Avoid half-cooked or raw foods. Why? It is said that the virus originated from animals, so might as well ensure our safe health through cooking your dishes well. Next, cover nose and mouth when coughing or sneezing. For those who experience the symptoms, to prevent transmission through droplets. Others, stay for at least a meter away from someone who is coughing and sneezing. Follow social distancing. Last, disinfect with the use of alcohol and wear face masks when going out. This may be heard everywhere but serves as our first line of defense. Kill those viruses with a 70% alcohol solution. Here are the lifespan of virus on surfaces. Over 72 hours on plastic and steel, 24 hours on cardboard, 4 hours on copper, and several hours on your hands. We are now to address fake news about COVID-19. Heat. The belief that staying exposed to the sun or higher temperature prevents COVID-19 is merely a fake judgment. COVID-19 is everywhere, no matter how sunny or hot the weather is. Alcoholic drinks. This belief does not protect a person against COVID-19 and is dangerous when consumed excessively. Mosquito bites. There is no study that coronavirus can be transmitted through mosquito bites. And last, banana. Health experts says there is no evidence that will prove banana can prevent COVID-19. Therefore, this is not reliable, although banana is good for the body. That is all. Thank you. Let us fight COVID-19 together. We are praying for our frontliners of this battle. Help them by staying at home and become a disciplined citizen in these trying times. Always remember, wash your hands and stay safe.